Hi all, welcome back. So we are now having a panel on good technology adoption part 1. So we are going to discuss about the reusability and interoperability of the DPG solution. So we have Anita Mittal from DCI who is going to host our panelists. She'll be the moderator. So I welcome all the panelists. Annina from OpenCRVS, Ewnetu M4H, Jeremi, OpenSPP, and Puneet Joshi from OpenG2P. Can we all please applaud?
Welcome to this afternoon session on fostering reuse and interoperability for sustainable solutions. I would be doing a short presentation to set the context, and then we get into a discussion with our 4 panelists. So today morning, we heard from Tina George on the importance of citizen centricity, user centricity, to give a good experience to the poor and vulnerable when they reach out for services. We also heard from Puneet on how the systems are fragmented, they are not interoperable. So now let us see 3 scenarios. The first one where John Doe applies for a social protection cash transfer program in a country where there are no digital systems. So he walks into an office with a bunch of papers, submits his documents to prove his eligibility, and these documents are then sent by snail mail, or a person takes them and verified against paper records in the civil register, in the social registry, or in other documents. And all this may take from few days to weeks or even months. So by the time you get a response on saying, yes, John Doe is eligible, you also want to check whether John Doe is still alive. So you ask him to come and show his face, give his bank details, and then when a van goes to his village, he gets his money. So what is the timeline you see from the time of application to what he gets? Probably a few months, 6 to 8 months. Now let us look at a scenario where there are digital systems, but they are fragmented. They are not interoperable. They don't talk to each other. So John Doe goes or applies from his home to a social protection program, and this program needs to verify the identity of the person, of John Doe, as well as some of his attributes. So these documents may be sent as an Excel file, or as an email, sent to the system verifies, responds after probably a reminder or 2, or a very responsive system may send it without reminders. And this whole process of going from one system to the other, getting the responses, and getting the money into the bank account or via cash by John Doe, it is much improved from those 8 months. Now we say probably it's few weeks. From few months it has become weeks. Can we do better? Yes, definitely we can do much better. And this will be through interoperability. Now let us look at a scenario where, the perfect scenario, to be scenario where we would like to go, where all the systems are there, digital, and they are interconnected. So John Doe comes or sits at the comfort of his home and gives his identity. There's authentication. Once he's established his identity, using this identity information, the social protection system goes to the CRVS system, goes to the civil registry and the social registry to get the attributes that are needed to make a decision on the eligibility of John Doe into the program. Once the eligibility is determined, a decision is provided to him saying, yes, you are into the system. And the details on what should be paid to him is sent to the bank, and the bank immediately transfers the money to his account, and a notification goes to him saying the money is there in your account. If you just look at him from a sad face, John Doe is a happy face. So this is what we want to give people. happiness, joy of getting a service. And how is this possible? This is possible through interoperability. And how we do get interoperability? I think this everybody knows. For interoperability, standards are indispensable. If you look at the two domains, the digital health as well as digital social protection, in the digital health domain, you have very well-defined standards and architecture, OpenHIE and FHIR standards. But if you look at the digital SP domain, there are no international, globally adopted standards. So to address this gap of lack of standards, many donor agencies, the SPIAC-B, Social Protection Interagency Board, which Tina referred to in the morning, which does a lot of analytics works. So they did a study. How do we address this problem of fragmentation? As a result of this study, it was decided to set up this initiative called Digital Convergence Initiative under USP 2030, which has members from government, non-government, countries, to build a harmonized and interoperable social protection delivery system through standards. So these consensus-based standards will help us deliver services seamlessly and also make our ecosystem adaptable and available for innovations. Once the standards are defined, you can build solutions on top based on the standards. It will reduce the time and cost needed to implement systems in countries. It will also enable you to mix and match components. So today you have OpenSPP, tomorrow you could have OpenG2P, and third day you could have OpenMS. If they're all adopting the same standards, you can plug and play different components as needed. And it also makes your design future-proof. Another fourth component or new technology solution comes, which integrates AI. Your solution can adopt those new technologies because you're based on standards. If you look at USP 2030, this is the power of building consensus, because you will see it has got lots of regional organizations like EU, Africa Union, IDP, part of this initiative, donor agencies, many other initiatives, as well as many countries who are members. So if the standard is adopted by this entity, then you get consensus and adoption from all this group as a whole. The initiative of DCI itself is steered very closely by three large organizations, World Bank, ILO, and GIZ. And now with the funding coming from EU, Expertise France and FIAB-B would be joining this group. So what do we mean by the interoperability framework? What is the basis for the interoperability framework for DCI? We are taking the EU interoperability framework and focusing on process standards, data standards, and technical standards to enable interoperability. So in the first phase, we are looking at these 7 interfaces. So a social protection delivery system, which is in the center, needs to talk to various other systems. It could be a civil registry, a social registry, or an IBR, or an identification system, or a payment system, and some sector-specific systems like pharma registry and disability registry. So one or more of these systems are typically involved in delivering a social protection cash transfer program or in-kind program to the people. So what is the approach we took to come up with these standards building process and consensus building process? So the first activity we launched was talking interoperability. What does that mean? Basically, we went to the countries who have done this well or who are struggling, and we did a technical deep dive of presentations from these countries on their integrated and interoperable social protection architecture, how they have achieved it, what were the lessons learned, what were the challenges faced. All these are available on our website, spdci.org, as recordings. So whichever country is of interest, you could go and watch the webinar again. PPTs are also available. The second activity we did was try to do it ourselves and see what does interoperability mean. So we had interoperability in action workshops, where we took each of the interfaces that we showed in the previous slide. So we had a workshop on interoperability of SP system with a CR system, with a social registry. So with an ID system for which we included MOSIP as the test bed. We implemented these and showed interoperability use cases live demonstration in these workshops. And countries also shared their experiences and processes on each of these interfaces. Again, these workshops are available on our website as recordings. We have, in this process, built collaboration with lots of initiatives like GovStack, G2P Connect, as well as with various DPGs. All these DPGs are contributing to our standards building process and also to these action workshops and standards drafting. So a quick peek into how do we do this standards process development as well as committees constitution. So the standards process consists essentially of 3 steps. The first step is drafting of the standards. So you need to have standards. So these standards can be submitted by any entity. If you have good standards for interoperability, submit to DCI, and we will take it up through a consensus building process. We also develop these standards through our contracted parties. Once these standards are drafted, we constitute standards committees which review each of these standards and provide their inputs on improving them further and building consensus. We also publish it in the public domain for anybody to contribute to these standards. Once consensus is built, we submit for endorsement to USP 2030 for adoption and implementation. So this is just to show that we have a very well-defined process with roles and responsibilities for each of the stakeholders defined for the 3 phases. And the standards committee, if you see, it is consciously created as a very well-represented community of people from international organizations, from countries, and here in the countries we take from the LAC region to the Africa and the Asia region. One representative at least from each region, as well as solution providers, both from the open source domain as well as proprietary solution providers contribute to building consensus on these standards. You also have very independent experts joining this on a pro bono basis, helping us create this digital public goods. So the first committee that we set up was the CRVS and SPMIS Interface Committee. 17 organizations contributed to building and reviewing these standards for building consensus. And this was finalized by also implementation. OpenCRVS and OpenSPP were 2 DPGs. So this is not just specifications on paper. They were implemented in DPGs and demonstration was done to show these standards work. The next committee that we have set up is for 2 interfaces on social registry and integrated beneficiary registry. Here 21 organizations are contributing and we are still in the midst of building consensus on this. Hopefully in the next 2 months we will have achieved consensus on these standards too. With this I will share with you the domain where all these, and the GitHub and Gitbook location, where these are available as open standards for you to adopt or contribute or review and provide your feedback. Now I welcome my panelists to give their perspectives on different aspects. So I'll probably first request each one of them to tell about their DPG, which DPG they represent, as well as a brief intro about themselves.
Thank you very much, Anita. So I'm from OpenCRVS, the digital public good, specifically for civil registration. And I was preparing last night, looking back over the work that we've done over the past, well, it's been a bit of a labor of love, right? It's taken a wee while to get to this point. But just looking back on it and thinking, wow, we need to do some more comms on this, because this is amazing. You know, we can talk about the value of civil registration, we can talk about the value of having a legal identity, of registering a birth, a marriage, a death, but it doesn't really come to life until you kind of, you know, we work together, different systems, and prove that value to individuals, right? The majority of people with whom we work with, especially at the lowest level, whose births haven't been registered, well, they say, why should we register? And I can tell them, oh, well, you know, your government's going to plan for you, and you can have access to services, and you know, it doesn't really mean anything to them. Whereas if you can say to an individual that, you know, you're going to get money for your newborn to make sure that they have the right food and the right things to help them thrive, mothers are going to say, yes, I'm going to go do that. You know, I'm going to go that extra mile, even if the process is hard. Hopefully it's not, because you CRVS and you're taking services to the community. But, you know, that is a language that mothers can understand. Or if a loved one dies, you know, and there's a widow allowance, for instance, you know, being able to say, you're going to be supported when your loved one is gone. These things matter because vital event registration is human, right? It's about the important events in our life. And those events come to life also when we are most afraid or most happy, and we want to be able to celebrate in the right way. So I just want to remind everyone, this is, you know, this is where you can create a massive amount of value, you know, countries for your populations. You can stimulate your economy and you can save money. And so how do you do that? So the use cases that we've collectively implemented increase the ability for accurate targeting. So integration we've done with OpenSPP and OpenG2P demonstrates sharing of data or querying the OpenCRVS database, having access to data to be able to see where births are occurring, to mothers of what age, where deaths are occurring, for what reason, being able to target social protection allowances and entitlements to individuals based on real-time data, right? Remember, civil registration is the only continuous population data available, so the value there is enormous. We also obviously have demonstrated when a vital event occurs, so for instance, a birth, we can notify the social protection system and they know that there's another individual who is eligible for a specific benefit. You can also, with access to civil registration data, calculate entitlements. So if you want to know how big a family is, how many children a mother has, you want to make sure that the information they're providing you is accurate, you can now do this with a trusted source. And again, that investment in civil registration provides that trusted source of vital event data to unlock all this value. And finally, I just want to build on something that Dr. Tina George mentioned this morning, which is dignity and making services really easy to access. One of the use cases we've demonstrated is the ability for a social protection system to scan a QR code on the birth certificate and to be able to pre-populate that data of an individual in the system. Trusted source, so you know that it's that individual, but also you're not asking that individual to fill in forms that they might not be capable of. We want to make these services as easy as possible. This integration, exactly that. So, you know, for countries who are thinking through their DPI strategies, who are investing in civil registration, who are wondering, is it worth it? I think through the demonstration of these things, and lots of lovely videos we can share to demonstrate this, it's absolutely worth it. And yeah, I implore you to explore more and would love to talk to you.
So that was a good explanation of how CR contributes to social registry. Just on the aspect which Annina mentioned with respect to dignity, with these notifications from CR, so suppose a new child is born and a social protection program is notified, a new birth has happened in this family, the program can proactively provide benefit to the mother. You don't even have to wait for the mother to apply for benefit. So this is the power of interoperability with these systems. So Annina, after social protection, what other interfaces are important from CRVS perspective?
Yeah, thank you very much, Anita. I mean, I think the opportunities are plentiful. Obviously, the use cases we've just described for social protection, there are more to explore. So we'll continue to work with each other, and would love to hear from countries of, what use cases you're looking to explore so we can prove them. Like we said, it's not just hypothetical, right? Integration with ID we've spoken about in previous days is obviously critical, providing that UIN or identity for life. And that can unlock value for integration with education systems. So in countries where you have to prove your age or you have a birth certificate to access education, where you're able to, again, query the civil registration system rather than you might have lost your document, etc. Again, it's about making services easy. Let's not make an individual and their family go to the civil registration office again. We know that process can be cumbersome. So integration with education is one. Obviously with health, receiving notifications, we've proven, but also sharing registration data back with health systems to be able to encourage health services to encourage people to register, right? So creating shared ownership of these same goals, which ultimately is ensuring that people participate in these important services. So a lot more still to do, Anita, thank you, but massive congratulations to the DCI initiative, and thanks to our colleagues. I think we all, appreciate one another. We're definitely not individuals working in a siloed way. We're working towards the same kind of North Star, and we look forward to doing that.
Thanks, Annina. So I'll now move on to Jeremi from OpenSPP. So you can introduce yourself, and then probably I saw your LinkedIn post on some new registries that you have come up with. Could you share with the audience what are those 2 new systems that you are providing as offerings?
Yeah, thank you very much, Anita. So OpenSPP is a social protection platform based on OpenG2P, and I think also one of the subjects is reusability. So we're leveraging the work on OpenG2P to build more things with OpenSPP, and so we're delivering, adding things like in-kind services, and building also social registry, farmer registry, and SPMIS in general. And on the reusability, so we were having a lot of people who were talking about a farmer registry, and there was nothing out there, and we were looking at what we had with OpenSPP, and we saw that we have 80% of the work because we've built OpenSPP to be able to support social protection program over many years, over decades. And so we built a strong registry part, and so it was fairly easy to say, to convert this to a farmer registry, adding more type of objects, and also being able to support a GIS, for example. And when we built GIS, we didn't build it from scratch, right? We leveraged also existing bricks, existing tools that exist. So we leverage PostGIS, which is GIS databases, and tools that people specialized in mapping called QGIS to be able to visualize the data, being able to do the targeting, merging data from different sources. So for example, pulling data from FAO maps, doing the queries there, and merging this with maybe categorical targeting, and creating the entitlement from this. So really pulling everything that is possible and trying to not reinventing the wheel, building a solution that is faster to deploy and integrate with what people are used to use, right? So, yeah.
Thanks, Jeremy. So I think I'll probably ask you this question. From your perspective as a participant in the DCI standards committees and other events, what is your learning, or what is it you would like to share with us?
Yeah, thank you very much. So, yeah, I've been working in multiple standardization body, and I think what DCI did that was interesting. So when we started, we already had a base, and they work on a base. Is also from the work of G2P Connect and merging this. So it was interesting to not reinvent the wheel and building out of this. And they prepared a lot of the work. And the other very interesting thing is the involvement of practitioners and technical people. So even though we did a lot of implementation, it's very interesting to see the other people's perspective. So there was people that are policy people that are in the field implementing, working with with the different ministries to do this. So that was very interesting. And I think after, we worked also a lot with Annina's team to test the API, verifying it works, and implementing it, and doing the demo. And I think a standard can only really become a standard when it's really used, right? And this is where we see also if a standards work, because there's so many people working on standards that has never been tested, and it's very important. And I think this is the thing that with DCI that we've done, that doing the implementation right away and even working on it as the standards is being built has been, I think, a really good thing. Yeah.
Thanks, Jeremy. So I'll now move on to Puneet from OpenG2P. We've heard Puneet today morning, but I'll just ask you this question. What are the areas you're working apart from what you shared in the morning? What are the areas for interoperability you're working apart from social registry?
Thanks, Anita. I think I mentioned in the morning that interoperability is part of our guiding principles. So, it's very embedded in the way we think when we design. I can see that there are three different interfaces that we are making sure that we are interoperable. One is the integration of OpenCRVS and OpenSPP, so that is one part of it. We are also making sure that the cash transfer side, we are interoperable. Because we are offering some components, but we want to make sure that these components are replaced by something else, if the country chooses to, it's not a block. So these are the disbursement API, where you're going to disburse, the cash or benefits. That we are making sure we're interoperable. There's also one ID mapper query. ID mapper is an important component I mentioned in the morning. That, it better be interoperable. It follows the standards. So there are at least 3 or 4 standards. And other than that, all the QR code scanning and so on, we are making sure that we are complying to VCs and verifiable credentials. So there's several touch points where we are making sure that interoperability is there, so that if you want to interact with any other system or replace the system, it should be possible.
Thanks, Puneet. So I know that you implemented the payment side of it in the Philippines. Any learnings that you want to share with us with respect to?
Right. So Philippines, we did a pilot for their AICS program. It was digitization of a small portion of their process. And although, it's like we know about interoperability, the concept, yes, everybody agrees. But when you start doing it on the ground, you realize it even more, the importance of such things. As it happens, concepts are one, and when you start doing things, you realize, oh, this is required. And there were at least, I would say, 3 to 4 touch points in that pilot where we realized interoperability is important. For example, when we are scanning the PhilSys ID, the QR code, now because that QR code is in a standard format, the CWT token, we realized that, hey, we developed an app, but anybody could develop an app to scan it. It need not be a proprietary app because the QR code is standard. Then we, offered this login using national ID because we are using OpenID on the back end. Well, the auth provider can be someone different, and you don't have to change your structure here. That was second. And the third was when we issued e-vouchers. So we made sure that they are in a verifiable credential format. Somebody else can scan it. Again, once you start doing you realize so many touch points in the system where you have to think interoperability. You will be easily end up making something custom. So, and there was another one on document store. We are following one of the standards, open standards. So I think there are several points. As long as we are aware, our design team, is there in the consciousness of the, everyone. We will make sure that things are, designed that way, and that's important, I think.
Thank you. So now we have the last panelist. Ewnetu, you can introduce yourself, and then also share with us what are the interoperability interfaces that you see in the OpenMS when it's implemented in the social insurance space.
Thank you. My name is Ewnetu Abera. I am from M4H, Management for Health. Currently, we are implementing OpenMS-based health insurance system for HIS. It's an Ethiopian agency for managing health insurance. As you know, health insurance is a health financing scheme, which has different approach. Like sometimes you use private insurance to fund insurance, or you may use social insurances or community-based insurances. All of these insurance schemes have innate values, like they are based on solidarity, based on risk pooling. So there is a need for managing the resource properly, otherwise it can be easily misused, squandered, unless you have an integrated system, interoperable systems, along with other mechanisms. For instance, if you see the value chain of insurance, it starts from enrollment of beneficiaries. Then it goes to service delivery. Then it goes to claim management. That's the core business of an insurance company. Then finally, payment disbursement. So when you do enrollment, that's the critical touch point that needs proper integration with national ID, verify the identity of the beneficiaries and their members with OpenCRVS, because you need vital event data to know who are the beneficiaries, their age group, their family status, so it's very important. Besides, not only enrollment, but when you see social insurance, you need to collect funds as much as possible, because it's a risky business. Easily you can get bankrupt if it's misused. So these social insurance and community-based insurance are based on contribution of individuals. So you want to know exactly the income of each beneficiary. So you need to have integration with tax systems so that you know people are contributing fairly to the this pool of funds. So it's integration with tax systems is very important. As I said, it's solidarity based. So if you there is no incentive to contribute more, because you contribute whatever you contribute, but you get an equal opportunity access to health facilities. So people are not incentivized to contribute more. So unless you have a mechanism to make sure that you are collecting as per your income, it's good to have integration with tax systems. Once the enrollment phase is passed, then when service delivery, you have to identify, verify the beneficiary when they go to the service delivery site. So that then comes to the, now again to the national ID to verify the identity of the individual. Besides that, when you do service delivery as a health facility, you just give the services, but your insurance policy is based on a benefit package. So you have to segregate which are covered and not covered. So you need to have integration with AMR. So you need to have that kind of interoperability with other health recording systems. So there are a lot of important integration points when it comes to health services in order to make sure that resources are very utilized in a strict and provident manner. So that's an important aspect in the health insurance.
Thank you so much. So probably we'll see if we can have a question or two from the audience. Anybody has a question for any of the panelists or for DCI? I think since the audience don't have a question, I'll take the liberty to ask one more question to Ewnetu. I know what has impressed me always with OpenMS has been its strong community that has been built around this digital public good. Could you share some good aspects or how it is done, what works well from the OpenMS perspective, since you're one of the part of the community, right?
I think the OpenMS is an open source solution, and it has a good community and implementers as well. Currently it's implemented in several countries, and here in Ethiopia we are just piloting it, and we are seeing a huge potential. At the first instance, when we do community-based insurance, we use another platform to manage that, but we see that this OpenMS has an integrated way of serving both community-based insurance and also social or payroll-based insurance scheme. So it covers all aspects of the social aspect of the health insurance processes. So it has a good technology background, it has a good community, so it will be helpful to connect with other systems as well. It supports both Open HI for integration with other platforms. It also supports FHIR so that you can also integrate with electronic record system. So I think it's a good solution which needs more investigation, more implementation across the globe.
Yes, so with this I think I thank all my audience, the panelists and the organizers for giving us this opportunity to share about DCI as well as the other DPGs. Thank you all.